up is the CEO of Quipt Home Medical. It's ticker QIPT. I see him backstage, and I see him on screen now. Greg Crawford, how are you, sir? Welcome.
I'm doing great. Good morning, everyone.
I love your. Is that a Bears? Is that a Bears stained glass lamp behind you there?
Cincinnati Reds.
Cincinnati Reds. Gotcha. All right. Let's go Reds. All right. I will let you take it away, Greg. Tell us a little bit about Quipt.
Yeah, sure. Thanks everyone for taking the time this morning. But Quipt Home Medical is a full-service home respiratory and medical device company. We currently operate in 15 states. We've got over 60 locations, and as mentioned, we primarily provide respiratory devices to patients inside their home. We've got over 150,000 active patients and deliver over 250,000 pieces of equipment annually, being referred by over 18,000 referring physicians. How we get our business, I like to refer to as the order life cycle. We have boots on the ground sales representatives. They call on hospital systems, physicians, long-term care facilities, home health agencies, anyone that would be caring for or discharging a patient for further care inside their home. Once those needs are established, they will contact one of our local service centers. They'll send over the proper medical documentation that's needed. That team will work with the insurance companies, obtain any pre-authorizations or predeterminations. Once all of that is finished and payment is secured from the insurance companies, it gets sent to our distribution team, and that's where we really shine. Our distribution team can consist of registered respiratory therapists, nurses, patient service technicians. They will either go to the patient's home or the patient will come into one of our facilities, depending on what type of device it is. They'll get that patient set up on the device. They'll provide all the education, ongoing support, and compliance in order to get those patients onto the device and for their physicians to see the benefits. From there, it's turned over to our billing team, and our billing team works the revenue cycle management, and they ensure collections from the insurance companies. Currently we have a strong and growing recurring revenue model. Right now, about 75% of our revenue is recurring, 25% is sales. That's up about 7% year over year. And that product mix is derived from home oxygen therapy, is approximately 23%. Sleep devices, which is approximately 19% or 21%. Sleep therapy supplies is approximately 19%. Our home ventilator program is approximately 17%. And then our basic home medical equipment and custom power mobility rounds out to complement those respiratory products at about 20%. We have a very diversified payer mix, with Medicare only making up around 40% of our overall revenue. Private insurance companies is approximately 38%. State Medicaid programs is approximately 12%. And then private inpatient pay is around 11%. So company highlights, we utilize technology applications in order to run the business that allow us to offer our exceptional service, and also allows us to remove a lot of the friction points in that are required to order this type of equipment for physicians. Once again, that strong and growing recurring revenue model of 75%. We also operate in an industry that's expected to reach the $84 billion mark by 2028, and it's close to $60 billion today. We also have a very active acquisition focus as we operate in a highly fragmented market with over 6,000, quote, unique mom and pop type providers. Also, we're operating in one of the best regulatory environments that we've been in well over a decade. One of the big reasons driving that recently, or last year about this time, CMS, the Center for Medicare and Medicaid Services, had made a decision to remove 13 product categories, and that from a program called competitive bidding that this industry had been subject to since around 2010. And the reason CMS removed those 13 product categories was, quote, because they did not achieve the expected savings. So what that's allowed us to continue to strengthen our patient base and also continue our patient care quality. But also, it's given us a clear margin outlook for the foreseeable future for our fee-for-service contracts that we have. Just some industry dynamics there. We are a true demographic play with 10,000 people turning 65 or older every day for the next 15 years. That's our core market. Also, the number of Americans in that suffering from sleep apnea, severe sleep apnea, is estimated to be at 22 million, and that 80% of those cases in that have gone undiagnosed. Also, the industry itself is growing at about 6% a year. We've been able to grow almost double digits in that over the past couple of years and outpace that. As far as our strategic growth initiatives on a go-forward basis, it's a three-prong approach. One is organic growth, the second is technology implementation, and the third is acquisitions. On the organic growth side, we kind of mentioned some of the tailwinds from the aging population. Also, we've seen the utilization of home oxygen, which represents about 23% of our business again, has increased about 15% in the last 5 years. We've also continued to see strong demand for non-COVID patients for home oxygen therapy as more and more patients have been treated in the home setting rather than going to the hospital. That continues to remain strong. Also, it's expected that the number of Americans with 3 or more chronic diseases is expected to increase over 171%. We believe with our diversified product offering, we're set to capitalize on that as we continue to treat patients with multiple cardio and pulmonary diseases. The second piece of our growth strategy is technology implementation. With this industry being so highly fragmented, we haven't seen a lot of commitment to technology. We've been very committed to technology over the past 3 to 4 years. We're completely tech-driven. It's continuously evolving. We're interconnected, and it's utilized system-wide. And really what tech has done for us is it's allowed us to create a totally connected healthcare platform for our patients, for our insurance payers, and our physicians. So it's allowed us to accelerate our growth and reduce a lot of the friction points in that for workflow processes. Another piece of our tech is our telehealth. We hear a lot about telehealth, and that since last year with the pandemic, we've had a telehealth platform in place now for well over 3 years. We utilize telehealth primarily to get patients set up on our respiratory devices, and it allows us a platform in that to reach patients and get them set up, allows us to work towards getting those patients compliant. So once again, in that what tech has done for us is it's provided this total connected healthcare platform for remote patient monitoring. Once again, with those benefits for patients, payers, and providers, it's allowed us to monitor their treatment plans and really drive early interventions in that through encouraging compliance through patient engagement applications, which has ultimately improved the outcomes for those patients. The third piece of our growth strategy is our acquisition strategy. Most recently, in that we've changed here in 2021, changed to a 3-tiered acquisition strategy. One being with looking at companies in that would be sub $5 million with the current regulatory environment. We believe this is a great time for us to expand nationally as we implement a land and expand type approach, and that's where we're able to acquire a company, obtain the majority of the commercial contracts that are needed to do business within a certain state or region. We believe that's good deployment of our capital, and to date this year, in that we've added 5 new states in that to our coverage area. The second is looking at heavily respiratory focused companies, and that would be very tuck-in type companies. And the third would be targeting in that much larger type companies from a revenue and an EBITDA standpoint that would allow us to really build a potential platform in other parts of the country that we're not currently covering, or in that to add specifically in that potentially new product categories in that to our current offering. Acquisition summary to date. You can see there in that this management team in that under Quipt has done approximately 9 transactions for a total of about $44 million in revenue. A good way to kind of look at our acquisition model is that we like to take low performing, low margin businesses and turn them into high margin performing businesses. You can kind of see by some of the examples that we have there that we've seen purchase price go anywhere from 2 to 5 times EBITDA. Or another way to look at it would be anything from, say, 40% to about 1 times revenue. And everything on there, on the examples there, would be prior to any synergies in that we would obtain amongst those acquired assets. Our strategic growth initiatives have resulted in our current run rate revenue of about $105 million. We're proud to say that we reached that 1 full quarter earlier than we were anticipating earlier in 2021. For calendar 22, and that we're kind of guiding at $135 million in run rate revenue with 22 to 25% EBITDA margins as we continue to scale the business, and we're able to grow those margins and that through our scale. 3 to 5 years, 250 million plus in revenue with 25% plus EBITDA margins. Some current financial information. We report on a fiscal year which ends 9/30. So we've reported thus far through June 30th our Q3 results in that quarter over quarter, and that we've seen an 8% increase in total revenue year over year. Some highlights there that we're pretty proud of is that for Q3, 41% increase in total revenue and a 21% increase in adjusted EBITDA. And amongst that 41% increase in total revenue, 7% of that was organic growth. We've taken the company all the way from a top line revenue standpoint for Q3 from 15.3 over the past 3 years all the way to 26.2 million. Adjusted EBITDA during that time frame has went from 2.8 million to 5.3 million. Some Q3 year-to-date 2021 results, which are through June 30th again. We've taken the company all the way from $44.6 million in 18 all the way to $73.2 million. And that adjusted EBITDA went from 5.8 million all the way to $15.9 million. So year to date, we've had a 38% increase in total revenue and 11% organic revenue growth. Also, another big highlight there on the slide is positive cash flow from operations has went from 9.7 million all the way to 11.9 million dollars. Also, with our operational excellence and our billing and collections, we've been able to reduce our bad debt expense and that from 10% down to 8% over the same time period. Our adjusted EBITDA margins on a full year basis from 2017 to 20 have went all the way from 1.4% all the way to 20.2% on a full year last year. On a quarterly basis, for the quarters in that they went from 18.3% to 20.2%. Our capital structure and inside ownership as of 8/20, we have a really tight share structure. We got about 33 million shares outstanding. The only debt that we really have is a convertible debenture for 11.6 million Canadian. That does have a convert feature, which we fully expect will convert in that in the time frame of about April of 22. It has a forced conversion on a 20-day VWAP of $6.40 Canadian. It'll convert at $5.20 Canadian. Those are the only numbers that are mentioned here in Canadian dollars. Our cash and cash equivalents is 33 million. We also have an untapped credit facility for $20 million. So that gives us well over $50 million in liquidity to execute on our growth plan as we continue to grow here very strong at 38% year over year. Our management team and our board is fully aligned with our shareholders as we own about 10% of the shares on a fully diluted basis. Some comp tables there kind of comparing where Quipt is currently trading based on our 22 estimates, and that Quipt is trading at about 6.6 times EV to EBITDA compared to the peer group there at about 10.6 times. Management team, myself, I've been in healthcare services for well over 25 years. I came to Quipt via selling a private company that I owned, and that had top line revenue of about $19 million USD. That was in 2015. Shortly after that, I was appointed as COO Took the company through a restructuring in 2016 and 17. At the end of 17, I was appointed as chairman of the board and CEO, and that's when the company started growing and becoming profitable. Also, Hardik Mehta, CFO. Hardik's been CFO for well over 3 years, so we have a lot of continuity on that piece. Hardik has a significant background in investment banking and M&A and data analytics. Tom Rurick, our EVP of Finance, over 30 years of hands-on experience in accounting and finance, is responsible for the day-to-day of our accounting department and our statements. We have 3 independent directors. Mark Greenberg is independent director. He's got over 30 years of senior level leadership experience, a background in investment banking and M&A transactions. He advises the company on all of its M&A transactions. Eugene Ewing has got over 30 years of hands-on experience, was also a partner in one of the U.S.'s largest certified public accounting firms. He also serves on the board of several NYSE-listed companies. Gene is the chair of our audit committee. He advises the company on all of its public filings and also the audit. Dr. Kevin Carter is an independent director. He advises the company on all of its clinical programs. And most recently, Quipt commenced trading on the NASDAQ on May 27th. I can now open up for some questions.
And of course, congratulations on the NASDAQ listing. Obviously, a pretty big deal. And I do have a couple quick questions here for you, kind of specifically on your acquisition strategy. Can you speak to the breadth or quantity for potential candidates that you have on the radar over the next couple years, let's say?
Yeah, so I wouldn't want to really speak to the number of transactions. We do have a very robust pipeline right now, and we do expect to be very busy as we get in to the last half of the year here and also into 2022. In fact, recently we've actually hired someone to oversee our acquisitions and integration.
Great.
But when we look at our run rate, or we look at kind of where we're guiding at $135 million run rate revenue, whether that comes through 3 or 4 transactions or it comes through one, in that still kind of remains to be determined. We do have a 3-tier approach there, and as we continue to find accretive acquisitions that fit our criteria, we'll bring them onto our model.
Yeah, I actually wanted to ask you about the 3-tier approach. Why the change in strategy? Were you basically adding another threshold that you wanted to require?
Yeah. Well, we just feel, just to explain it a little bit better to our investors, and that with the regulatory environment and that's really kind of taken effect here in 2021, and this clear outlook that we have from a reimbursement standpoint, we thought that this is a great time and that for us to kind of start looking at smaller transactions so we can start adding states in that to our coverage area. So we thought with that regulatory environment, that's really good for national expansion. And then we continue to look for those tuck-in type opportunities that are heavily respiratory. And then the third, with our improved balance sheet, and that we've got the most pristine balance sheet that we've ever had in the company's history. And there are larger transactions out there from a more material size from revenue and EBITDA that could substantially change the company. And we feel that we've got the balance sheet, we've got the expertise, and that to close a transaction like that, then that should be a part of our growth strategy go forward.
And I think I saw on your slides that you want to focus on respiratory. Maybe an obvious question, but why the focus on respiratory? Did the pandemic have anything to do with that?
No, not really. And that I think the pandemic, what it's really done is it's just kind of really brought to kind of the top there of taking care of respiratory patients in their home. We've been respiratory focused for many years,
right?
Where we have gone, and that's say over the past 3 or 4 years, from about 70% respiratory to 80%. But we feel that we've really carved a niche out in the marketplace for our clinical expertise out there, along with providing these devices, along with the remote patient monitoring. That's resonating very well with physicians and hospital systems. So that's why we've continued to stay very focused on those programs.
Excellent.
We believe, if anything, at this point, the pandemic is kind of holding us back from being able to expand our services.
Interesting. Awesome. Well, thanks for joining us today, Greg. He is CEO of Quipt Home Medical. It's ticker QIPT, Greg Crawford. Thank you very much for joining.
Thank you. Everyone have a great day.
You too, sir.